School canteens may soon have to say goodbye to chips, burgers and sugary drinks. And hospitals, they'll be following suit too. Karnataka has announced a statewide ban on the sale of junk food in schools and hospital canteens. Health Minister of Karnataka, UT Khadar, says the move is aimed at reducing lifestyle diseases caused by unhealthy eating habits. The initiative will begin at Mangaluru's District Wenlock Hospital before being expanded across the state. The government also plans to strengthen food safety by upgrading food testing laboratories and introducing stricter quality checks. So the next time you're looking for a quick bite at a school or a hospital, don't expect fries on the menu. Healthier options are set to take their place. We have Priya Nagwani, nutritionist, now joining us. Priya Nagwani, thank you so much for taking time out to be with us here on Unmissable. A much required move. I know, like the midday meal scheme in the 1950s, which Tamil Nadu introduced, which sort of set the template. Hopefully, this move by Karnataka sets the template for other states and other governments to follow.
Thank you, Krishna, for having me here. Yes, of course, I think that's a great move. And it should set an example for the rest of the states. It's a very, very welcome move given the increase in child obesity and early onsets of diseases like diabetes and hypertension. It's a really good move. The only question would be if they are able to execute it well, because I think in 2019 as well, Karnataka government had the same intent shown, but largely it was unenforced. So this time I'm really looking forward to seeing this executed.
Looking forward to not just you and me, but everybody, with the kind of health awareness that exists these days and awareness about lifestyle disorders caused by unhealthy eating habits. I've always wondered how come these junk foods found a place inside canteens in hospitals specifically, because you are in the hospital because you have you have disorders, and then there you are eating the worst kind of food possible. So I just thought that that struck people a little late, that at least if not anything, hospitals should be the places stocking these things.
Definitely. I think schools and hospitals are the places where you don't have a lot of independent choice, and that's where you can enforce this. It basically, you cannot normalize junk food in institutions, right? So I think if a government is able to do it, it would be a great initiative. And also, I think education simultaneously would also help, especially to the school children, because it's not just about enforcement, it's about preparing them for the future, and preparing them with the kind of knowledge that they need to maintain their health further as well.
The only question is, you're talking about implementation. From the looks of it all, it should not be too difficult. It requires a directive to schools across the state of Karnataka, and it requires a directive to hospitals. Hospitals, I'm guessing, will be more than happy to comply. The only other question is cost, isn't it? If you remove these junk food items from the shelves, they are invariably available at a very attractive price. It's what you replace them with is also going to be extremely crucial.
That's right, but it doesn't have to be very exotic or expensive. You can replace school snacks or hospital snacks with very healthy basic items like sprouts or idlis or millet idlis or roasted chanas and all. So these are much better than the packet chips and juices that are currently available.
They are much better, but are they being made in those numbers that will be needed to stock these canteens across schools and hospitals?
If you're talking about economic burden, I think the economic burden of having obese, diabetic, and hypertension folks in the country would be much bigger. So I think this is something that, and also it's for the state to answer. But yes, I mean, I think there should be a transition plan if you don't want the financial burden to fall on the vendors. Maybe they can be incentivized or given some incentives for healthier alternatives rather than a complete ban initially, so that there is a smoother transition from the junk to the healthier food. This may be one angle to look at it.
Yeah, healthier alternatives is one thing, and the other is, of course, ensuring there's enough awareness, because one thing is removing them from canteens only for the students to rush out to the nearest petty shop close by to buy the same things.
That's true. I think, like I said, education has to be in parallel. They need to know why these items have been removed and what it does to their bodies slowly. And kids specifically, they crave sugar, and I mean, they don't understand how it impacts their long term health. And I think the 100-meter thing would be a little difficult because they were not able to implement the 50-meter thing also in 2019. So it would be interesting to see how they're able to implement it. But yes, I think removing the options in the nearby places also will play a role in ensuring that the school children, are eating healthier alternatives.
The one last question, Priya Nagwani, before I let you go. They say, nothing is harmful if you eat it in the right proportions. Would you subscribe to that? It's not like if you have a plate of fries, you've just like completely ruined everything. It's about the number of times you go towards having a plate of fries or a burger for that matter.
I agree. Frequency and portion matter just as much as the food itself. So probably, I think there was one debate recently for the samosas and gulab jamuns as well. So see, if something is freshly made with fresh ingredients, once in a while, if it is deep fried, it's not going to do as much damage as something in a packet eaten daily. So that judgment has to be taken. So, for example, if there are school menus, then once in a while you can introduce this Indian snacks which are kind of deep fried because they are culturally linked, and it makes people happy,
Right.
right? But once in a while is not a problem. It's the
Fair
daily
enough.
thing that matters.
Fair enough. Once in a while is not a problem. We leave it at that. Priya Nagwani, nutritionist, thank you so much for taking time out to be here on Unmissable
Thank
on News9.